Hey everyone, it's Dr. Matt Link here from the Walton Clinic, and I just want to shoot another video as a follow-up for a video I did earlier today because I had a question from a patient asking me about her husband, what causes degenerative disc disease. So check out our other video that talks about what causes degenerative disc disease, but as I said previously, I wanted to shoot a quick video as to what can people do to combat the effects of degenerative disc disease. So there are many things that can be done, some of them more effective and better for your body than others. Okay, so let's talk about that. So if you go the traditional medical route, okay, most likely they're going to say, all right, go ahead and just start off with taking some Tylenol or NSAIDs, like an anti-inflammatory such as ibuprofen, Aleve, stuff like that, okay, to help get rid of inflammation. You know, getting rid of inflammation and pain is good, obviously. Nobody wants to be in pain and have issues like that. But as you can see from the video I did earlier, that doesn't necessarily correct or take care of the problem, okay? So that's one issue there, okay? Thinking that your pain is gone, has corrected the problem, is a problem in of itself, okay? Pain is a warning sign that there is a problem going on that needs corrected, not just getting rid of the symptom, okay? So again, staying with the medical route, you know, one of the other things that I hear from a lot of my patients is they sent me to physical therapy. Now, many of you might start thinking, wow, he's got something against physical therapy. That is not the case. I actually have a degree as a physical therapist assistant, so not as a physical therapist, but I do believe in physical therapy, and in conjunction with some of the other things I'm going to talk about here, can be very, very effective. Okay, so we'll put that on the table for a second. Now, the next thing that your medical doctor might recommend to you is a cortisone shot to get rid of inflammation and pain, and in their eyes, correct the problem. If your pain is gone, the problem's corrected. That is not the case, again. So what that does is the shot, the anti-inflammatory, whatever it is you do as a medication, gets rid of the pain, but what caused the problem, because those joints in your spine, or maybe even your knees or hips, whatever, start locking up. They're not moving as correctly as they need to be. So while your pain is gone, your spine continues to break down because it's not moving correctly. You're feeling good, but your spine is breaking down while you're feeling good. And I'll add this as well, there is more and more and more research coming out showing us that cortisone shots actually cause more damage to your joints, okay? So, again, while you're feeling good, your joints are breaking down, and even more so because of those cortisone shots are actually causing the bone to break down, the joint to break down. So, you're causing yourself more and more problems. And for people who get multiple cortisone shots, I've had patients who have come in and who have had multiple shots within a matter of months, and they're still having pain, and now their spine is probably breaking down even more so and quicker because they had those shots. So again, not something we recommend, okay? Now, let me take a step back here for a second. As I said earlier, getting out of pain is important. So if for some reason, you know, I've had patients in the past be like, oh, you're totally against medications and whatnot. No, that is not the case. At the proper time, the medications can be very effective, okay? Again, getting rid of pain and inflammation is important, but correcting the problem is the key, okay, and what needs to be done. Now, the next route in the medical arena to correct back pain, depending on how bad the problem is, they might recommend surgery. Okay, now here's another thing that I'm strongly against, unless it's, there's a time and place for everything. Okay, and surgery, every now and then there is a time and a place for it. But that is not the necessary mode that needs to happen, okay? Because as I talked about in my previous video about degenerative disc disease, the spine stops moving appropriately, okay? So why would going in and doing a surgery to fuse the spine together be the right thing to do, okay? Because if the spine's not moving appropriately and that's what's causing the breakdown, why would fusing the spine together be helpful? It's not, okay? Because what happens, and I actually, like I showed you in a previous video, I have a patient currently who had a spinal fusion. She's got screws in her spine, okay? And now because of that, the spine, the joints above that fusion are starting to break down. She's having more issues because her spine wasn't taken care of appropriately from the beginning, okay? So that spinal fusion is causing more issues. So what we do here as chiropractors is restore spinal motion. That is the key. That is what we recommend. That is what we are known for. There's so much more research on the benefits and effectiveness of chiropractic in restoring spinal motion than there is for medications or surgery, okay? Now, I had also mentioned earlier physical therapy, okay? That involves a lot of, stretching and exercises. In our office, we not only utilize chiropractic, which restores spinal motion, we also use different modalities to help the spine as well. So we recommend and prescribe our patients certain home stretches and exercises that they can do, stuff that patients need to do to get your muscles loosened up at home, because that is important as well. Stretching and exercises does not restore joint motion. All it does is helps the muscles loosen up, okay? As chiropractors, we restore joint motion. You got to get in there and get those joints moving better, okay? And stretching and exercises doesn't do that, okay? Unfortunately, okay? That just, again, is a temporary relief of issues, okay? I'm sorry for any physical therapists out there that I might offend with this, but we got to restore spinal motion, okay? So recap: medications, cortisone shots, physical therapy, surgery, all those, especially in and of itself, not effective. Getting the joints moving better, stretching the muscles, helping your body restore proper motion, that's what's going to be the most effective in getting your spine moving better and functioning better, and also keep it from breaking down further. Now, in another video, so stay tuned, I will talk about different exercises that you can do at home to help your body. Again, we talked about the coupling exercises with chiropractic is what's going to be the most beneficial, but there are some things you can do at home to help your body, and I will talk about those in another video, okay? So this is Dr. Matt Link, again with the Walton Clinic of Chiropractic, reminding you to stay healthy, Springfield.